So now we will be starting the class. So your today's topic is cranial nerves. So there are basically 12 cranial nerves. 12 cranial nerves. There-
वेलकम भाई
Please
हम
mute
क्लास ले लें आप
yourself.
अपने प्राइज एंजॉय
Please mute yourself and turn on your cameras if you are comfortable. Those who are comfortable in switching on the camera, you guys can turn it on. Okay. So, very first thing is there are 12 cranial nerves. Now I will be writing the names of different cranial nerves and you can write this down in your
गुड
notes.
इवनिंग मैम
Good evening. You need to memorize these cranial nerves according to their number. First one is olfactory. Olfactory nerve. Then optic nerve. Then oculomotor nerve.
मैम क्लास इज जस्ट स्टार्टेड ना
Yeah, class has just started. So our today's first topic is cranial nerves. There are 12 cranial nerves in our body and now I am writing their names. Fourth one is trochlear nerve. Then trigeminal. Abducens. Facial. Vestibulo-cochlear nerve. Glossopharyngeal nerve. Vagus nerve. Accessory nerve. And the last is hypoglossal nerve. So these are the 12 cranial nerves in our body. So are you guys done with the writing? सबने लिख लिए cranial nerves के names?
मैम थोड़ा वेट करें
Okay.
डन मैम
So now we will be learning one new disease. The name of the disease is trigeminal neuralgia. There is one more name of this disorder. These two means the same. So what is trigeminal neuralgia? So आपने कभी इस word का नाम सुना? Have you ever heard about trigeminal? Yes. Have you ever heard about the nerve trigeminal? Trigeminal. कहाँ अभी हमने देखी trigeminal? Trigeminal is the 5th cranial nerve. तो अब इस disease में क्या होता है? इसमें जो आपकी ट्राइजेमिनल नर्व है विच इज द 5th नर्व वो अफेक्ट होती है. In this disorder, trigeminal nerve is affected, which is cranial nerve 5th. This is a sensory disorder. This is a sensory disorder. सेंसरी डिसऑर्डर क्यों है? अब हमें सेंसेशन किसकी वजह से फील होती है? अब अगर हमारी ट्राइजेमिनल नर्व ही जो 5th नर्व है वही अफेक्ट हो जाएगी तो उसकी वजह से हमें सेंसरी डिसऑर्डर होगा. Now what all will happen in this disease? First will be, this is sensory disorder of trigeminal nerve. Then there is severe pain on lips, gums and cheeks. अब यहाँ पर पेन क्यों होता है? रीजन बीइंग, जहां जहां भी हमारे फेस पे ट्राइजेमिनल नर्व होगी, अब वो नर्व अफेक्टेड है, तो उस नर्व के सराउंडिंग जो भी एरियाज है उनमें सिवियर पेन. नेक्स्ट देयर विल बी स्टैबिंग, burning pain, it can be one side, there is twitching on the face, blinking and tearing. Have you all written?
Yes, ma'am.
तो इसमें क्या है, इस ट्राइजेमिनल न्यूरैल्जिया डिजीज में we all got to know about what all happens. साइन एंड सिम्टम्स हमें पता चल गए. कॉज क्या है कि जो हमारी सेंसरी डिसऑर्डर है किसका? ट्राइजेमिनल नर्व का, जो कि हमारी फिफ्थ क्रेनियल नर्व है. अब इसमें हमें क्या ध्यान रखना है? व्हाट ऑल थिंग्स यू नीड टू टेक इनटू कंसिडरेशन? द वेरी फर्स्ट थिंग इज अवॉइड हॉट, कोल्ड, फ्लूइड एंड फूड. जो पेशेंट होगा ट्राइजेमिनल न्यूरैल्जिया का, उसको आपने कहना है कि आपने ज्यादा गर्म या ज्यादा ठंडी चीजें नहीं खाई. देन chew on.
Explain in English.
Okay, so here we will instruct the patient of trigeminal neuralgia to avoid excessive hot or cold fluid and food. Then we will instruct the patient to chew on the unaffected side. As we have learned here that it can be on one side. It can affect your one side, which means your other side is unaffected. So you need to instruct the patient to chew on the unaffected side. Then avoid caffeine. Then the face should be cleaned by soft cloth. Then the water should be lukewarm. Now what happens is, if there is pain on the cheeks, on the jaw, on the lips, then the patient might face difficulty in communicating. He might face difficulty in speaking. So, in order to communicate, you can give that patient paper and pen to communicate. You can give them paper and pen, and you can instruct them to write whatsoever they want to tell you. Now, medication. As we know, here,
Ma'am,
nerve
can
is
you show
affected.
the previous slide?
Sure. So as here we know the nerve is affected. So the medicine which we will give is carbamazepine and gabapentin.
Okay, ma'am, you can continue.
We will give carbamazepine and gabapentin. One more thing which you need to instruct the patient and keep in mind is no massage. The patient should not take any type of massage on the face. The patient should not take any type of massage on the face. So there is one surgical management as well. So surgical management is rhizotomy. Rhizotomy. This is neurosurgical pain management procedure. So this is all about trigeminal neuralgia. So you all are done with the writing? Yes?
Yes, ma'am.
Okay, now let's revise. So what is trigeminal neuralgia? Here, which nerve is affected? Yes.
Trigeminal nerve.
Trigeminal. This nerve is affected. And this is a which disorder?
It's a sensory disorder.
Yes, it is a sensory disorder. Then the sign and symptoms are severe pain
of
on
lips,
Severe pain
on
on
lips,
lips, gums and cheeks, gums and stabbing, burning pain.
and then
can be
now
one side.
here you need to keep in mind if you ever get the question like what is the nature of pain in trigeminal neuralgia, what is the nature of pain? Nature of pain is stabbing and
Stabbing and
Stabbing and
burning.
burning pain.
okay. Now it can be on one
One
side.
side.
Then twitching, blinking and
Blinking and
tearing.
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 Yes. And what you will educate the client that he or she should avoid
Hot and
Avoid
heat and cold.
fluid and
Avoid
touching.
you on
You on
unaffected side,
unaffected side.
avoid
Avoid
of
cafe,
caffeine.
cloth saline.
soft cloth to clean face, lukewarm water, and paper and pen to communicate. Then the medicine is carbamazepine, gabapentin.
Gabapentin.
One more thing, no
No
massage.
massage.
No any type massage.
Yes.
On the face.
And the surgical procedure is rhizotomy. Rhizotomy, it is a
Neurosurgical pain
neurosurgical
management
pain
procedure.
management
Surgical pain
procedure.
management procedure. Ma'am,
Any doubt?
right.
Yes.
Ma'am, in rhizotomy, what they will do that cutting the nerves.
No. The nerves which are damaged, that nerves will be removed.
Damage.
Yeah. So, any doubt in trigeminal neuralgia?
No.
Any query? Clear with this topic? Are you clear
Yes,
with this
ma'am.
topic?
Yes, ma'am.
Now we are moving to our new topic. Please mute yourself. Please mute yourself. Don't unmute. Your next topic is Bell's palsy, which is also known as facial paralysis. So now, tell me one thing. These are the cranial now. Tell me which is the seventh cranial nerve.
Facial now.
Facial nerve. So here, your seventh cranial nerve is affected, which is कौन सी nerve है ये?
Facial now.
So what happens here is there is inflammation of cranial nerve 7 due to viral infection. Due to viral infection. Done?
Inflammation of cranial nerve due to viral infection.
Yes. Inflammation of cranial nerve 7. The seventh cranial nerve. That will be inflamed. Now, sign and symptoms. Unilateral facial paralysis, asymmetry, affect side, any viral infection. Then if there is any viral infection that can affect this nerve.
Okay.
The affected side, you will get to see three things. Eyebrow is not raised. Now here, can we raise our eyebrows? We can raise both of our eyebrows. In this patient, the side which is affected, that eyebrow won't be raised. Then the eyelid not closed. Then puff out. Puff out cheek, not possible. Puff out cheek, not possible means, am I able to puff my cheeks? I am able
Yes.
to puff both my cheeks. Here in these patients, the affected sides, as there is paralysis, they won't be able to puff the cheeks, won't be able to raise the eyebrows, and won't be able to close the eyelid. Then there will be drooping of eyes, mouth. Then unilateral taste loss. There will be pain behind ear. The speech will be slurred. The speech won't be clear of this patient. The nasal labial fold. The nasal labial fold, this one. It will be flat.
Like
One
nostrils.
This fold, this labial fold.
Side one.
मैम ये स्पीच से पहले क्या लिखे आपने?
Sorry.
स्पीच से पहले क्या लिखे आपने? स्पीच से पहले मैम.
स्पीच से पहले slurred. ये spelling SLURRED, which means not clear. अब affected side में you will get one more thing. That is, there will be no wrinkles on forehead. On the half of the head, there will be wrinkles, and on the affected side, there won't be any wrinkles. Yes, Farhad?
What are we studying?
So we have already studied one topic, which was trigeminal neuralgia. Now this is the second topic, which is the facial one.
Bell's palsy.
So let me show you slides so that you can get to know. 1 minute. So this is the topic, Bell's palsy, which is also known as facial paralysis. Seventh cranial nerve is affected. Inflammation of seventh cranial nerve because of any viral infection. There could be any viral infection. Then the unilateral facial paralysis, there will be asymmetry. The side which is affected, eyebrows won't be raised, eyelid won't be closed, the cheeks won't be able to puff out. Then there will be drooping of eyes, mouth, and the tongue taste of unilateral. Unilateral means one side. One side of your tongue, you won't feel any taste.
Pain behind ear.
Then there will be pain behind your ear, the speech won't be clear, and your nasal labial fold will be flat, and the side which is affected, there won't be any wrinkles on the forehead.
Can you please open the first slide?
So
Bell's
currently,
palsy.
first I will complete this topic, then you will get time to, you should join on time from tomorrow.
Okay.
So there are few things which you need to keep in mind and you need to instruct the patient is, now tell me one thing. If one eyelid is not closing, what could be the risk? Anything which comes into your mind whenever one eyelid is not closing, it's open.
Cornea dryness.
Yes, there could be dryness. So what we need to do, we need to protect the eye from dryness. And how we can protect? There are 3 methods. First is you can patch eye. Then the other is artificial tears and sunglasses. These 3 methods can be used. Then prevent injury on that face, no chewing on affected side. Now tell me one thing. Trigeminal neuralgia, you were able to instruct the patient to do the massage or not? In trigeminal neuralgia,
No, ma'am, no.
No, ma'am.
Yes.
No, ma'am.
Yes, good. But in facial paralysis, you will instruct the patient to do upward facial massage. There is this important difference between these 2 diseases. Then medication. There will be, now the cause was because of any viral infection. We need to give antiviral med. Then prednisone. So these are the things which you can do in facial paralysis or Bell's palsy. Now tell me one thing. In both the diseases, there is paralysis of face, right? In both the diseases, there is drooping. Now, how you can distinguish trigeminal neuralgia from Bell's palsy? Anyone from your side? Yes.
Exactly affected only one side.
Ma'am, ये one side है पहले वाली.
So in
And
trigeminal neuralgia also, trigeminal neuralgia is also on one side.
One side.
So then,
And these
so
are
now
both
tell
the
me
same.
one thing. There was pain in trigeminal neuralgia. Is there any pain in facial paralysis or Bell's palsy? Bell's palsy में pain
No.
होगा?
Yes, ma'am. Behind the
Yes.
ear.
I'm talking
Behind
about
the
face.
ear.
Face.
No, no, ma'am.
There is no pain in facial
Pain.
paralysis.
Yes.
Okay. Then one more thing. In trigeminal neuralgia, there was twitching, blinking, right?
Yes,
Whereas
ma'am.
in Bell's palsy, there is nothing
Dropping
like
of
twitching
eyes.
or yeah. And in the
Mouth.
now tell me one thing. In trigeminal neuralgia, the eyelid was open or closed? In trigeminal neuralgia, here there is a closing of eyelid or the opening. What is the meaning of blinking?
It will be blink, ma'am. It will not
Blinking
be
means
like,
Open and close.
yeah.
yes, that means the person can open and close his eyes. So in this way, in your examination, you can distinguish between trigeminal neuralgia and Bell's palsy. Okay, mostly students get confused between these two diseases. Any doubt with this disease, Bell's palsy? Yes, any doubt? कोई doubt है या we should continue?
Continue.
Ma'am, clear. All done.
Okay.
I have one doubt.
Yes,
Trigeminal
Govindraj.
neuro. Yeah. That is why we need to avoid the caffeine.
You need to avoid what?
Caffeine.
Because it
Caffeine.
will stimulate the nerve for the
Food.
Okay,
pain.
you are trying to tell like we need to avoid caffeine, right?
Yes. Yes.
Yes. So what's your
Yeah,
doubt? What you
He's
want to
telling
ask?
What is the
why we
reason?
need to avoid the caffeine.
Why you need to avoid the caffeine in this thing you are talking about, the trigeminal neuralgia, right?
Yes.
Now tell me one thing. What I said, this trigeminal neuralgia is which disease?
Sensory.
And
Sensory
it is
disorder.
because, and what is involved in this? Nerves. And what
Trigeminal nerve.
nerves? And what does caffeine do to your nervous system and your nerves? They have its direct effect.
It will stimulate the nerve.
Stimulate
Yes, very good, very good. So, in order to avoid the stimulation of any nerves, especially this one, we need to avoid any stimulant. There, instead of caffeine, you can also write there if there is any stimulant, you need to avoid. There won't be any stimulant. Now, clear with your doubt?
Yeah, I got it. Thank you.
You got it? Okay. Okay, now let's switch to our next topic. The next one is, any idea what is this topic? Amyotropic lateral sclerosis. Amyotropic lateral sclerosis. So here what happens is, both upper and lower neurons, especially motor, upper and lower motor neurons are affected. Both type of neurons are affected in this disease. Now tell me one thing. Here, upper and lower motor neurons are affected. So is there any involvement of central nervous system?
Yes.
No.
Yes, ma'am.
No. There is no involvement, no problem. There is no problem in central nervous system. The reason being, which neurons are affected?
Upper and lower. Motor.
Which one? Motor neurons are
Motor
affected.
neuron.
Now, one more thing you need to keep in mind here, glutamate problem is there. Now, what was the function of glutamate? Yes, glutamate का function. What is glutamate? Yes, you are not audible. Yes, we learned glutamate.
Is a neurotransmitter.
Yes,
It
excitatory.
just excitatory function.
Now tell me one thing. अब मैंने आपको यहाँ कहा था. Now here I told you there is no central nervous system problem. There is motor problem and there is which problem? Neurotransmitter problem. You need to keep this in mind. There is neurotransmitter problem, which is glutamate problem. Now this is progressive in nature. ये बढ़ता ही रहेगा. It is progressive in nature. And there will be loss of all functions of muscles. All muscles. All of your muscles will lose their function because motor neurons are involved. And there will be respiratory problems as well. There will be respiratory problems. Here, one thing you need to keep in mind is in patients with amyotrophic lateral sclerosis, the main cause of death is from any idea? Respiratory failure because all muscles are involved. Now its sign and symptoms. Fatigue. There will be fatigue, cramping, muscle weakness, dysarthria, dysphagia, and there is one more symptom which is fasciculation. The meaning of fasciculation is twitching of muscles. One thing you need to keep in mind is this is the early sign. Early sign in amyotrophic lateral sclerosis is fasciculation, which means twitching of muscles. Now here, what you need to do. As I mentioned here, mostly the death is because of respiratory failure. Now, your priority here is airway. Airway is your priority. You need to suction and provide oxygen whenever needed. Then ABG analysis is done. Head of bed will be 45 degree. You will instruct the patient for coughing and deep breathing exercises so that the secretions are excreted. Then incentive spirometry. Chest physiotherapy. Then you need to get all flu shots and pneumococcal vaccine done of the patient. You need to check swallow reflex. Why we will check swallow reflex of the patient? What is the need to check this reflex before giving any fluid, any food? What is the reason? Why
Because
we will check?
patient has a sign of dysphagia.
Yes, very good. The reason being because motor neurons are affected, and we have learned that the muscles will slowly lose their functions. The muscles won't perform their functions, so there are chances that the patient might face problem in swallowing. So we need to check swallowing. Then you need to provide only thick fluid. Then you need to tell them about energy conservation methods. Now, what are energy conservation method? What does this mean? Now listen carefully. Energy conservation methods means you need to tell the patient that you need to save your energy. How? Like, for example, if the patient is going to take shower, you should instruct the patient to keep one chair so that he can sit and take shower in order to preserve his energy. Then you can instruct the patient to do the things by sitting and not to strain his or her body. So these are the things which you need to keep in mind. Then there is one medicine you can write, riluzole. Now, what happens in these patients, like at the end or in future, like as the disease progresses, these patients usually get NG tube. Reason of NG tube?
Nasogastric tube.
Why we will give this tube? Like why the patient will be having NG tube in future? Reason being
It's
because
to
his
avoid the
Because it
aspiration.
was
yes, he will
difficulty of swallowing.
slowly he will lose all his muscle functions, so we will need to give him NG tube. One more thing is there could be yeah, like if the muscles are losing function, then he might face problem in respiration as well. So in that system also there could be tracheal tube or NG tube. These two things can be there, which you can expect. Any doubt in this disease? So what happens in this disease is so amyotrophic lateral sclerosis. Here, your which motor neurons are affected? Yes. Which
Upper and lower.
motor neurons? Upper and
Lower
lower.
motor.
Lower
Yes,
motor neurons.
are affected. Both your neurons are affected. Upper as well as lower. Both. Then there is no central nervous system problem. Then there is neurotransmitter problem, which is of which one?
Glutamate.
Height problem.
Sorry. Yes, Rosalie.
Glutamate.
Yes, glutamate. And its nature is, this disease nature
Progressive.
is, yes.
Progressive.
And with the time, the patient will lose
All the
all
function of
Loss of
functions,
all functional muscles.
and it will lead to respiratory problems.
Problem.
Then sign and symptoms are there, and the death be from respiratory failure.
Respiratory
Signs
failure.
and symptoms: fatigue,
cramping,
Cramping,
muscle
Fatigue,
weakness,
muscle weakness,
dysarthria, dysphagia,
dyspepsia,
fasciculation.
What is the meaning of
Fasciculation.
fasciculation?
To chink of muscle, and it is the early
think of
sign.
muscles.
Yes, good. Then what all you can do?
Airway, and it is a priority. In airway, we can do suction and give oxygen. And after that,
We
ABG.
can take the
And
ABG,
the bed is
breathing
45 degrees.
exercise, coughing,
Coughing,
spirometry, and chest
decrease
physiotherapy.
What is the
chest,
meaning of dysarthria?
Joint pain.
joint pain.
Yes. Joint pain is arthralgia. Legia.
It is not,
Thria
it is not
is
joint
speaking
pain. It
difficult.
is less movement. Unable to
Don't
move.
confuse. You are confusing two terms. Listen. Let me show you.
Dysarthria is difficulty in movement.
There is one term, dysarthria. Dysarthria, which means, what does it mean? Yes.
Difficulty in
Yes.
movement.
Difficulty in what?
movement.
Wait. You are confusing two things. आप कंफ्यूज हो गए हो टू टर्मिनोलॉजीज में. This means speaking difficulty. And this means, ये आप हाईलाइट कर लो. Highlight this in your notebooks. अगर और if now tell me one thing, अगर मैं इसके आगे poly लगा दूं उसका मीनिंग क्या होगा?
Sorry,
Poly, if I will add polyarthralgia, what does it mean?
It means
Whenever,
increasing.
no, you are trying to say the right thing, which this means whenever there is poly, okay, whenever the prefix is poly, that means more than one. If there is polyarthralgia, that means more than one or two joints are. Okay. Then where were we? Then now what you will do? What you will do? क्या करेंगे हम in amyotrophic lateral sclerosis? Yes.
Then, ma'am, all the flu shot and pneumococcal vaccine we will give.
No. First, what will
First
be your
is the
priority?
first
Airway.
airway is priority. Then we have to give the suction
Few
oxygen
waters.
therapy, ABG, coughing, deep breathing exercise.
What about head of bed?
45 degrees.
Elevated about 45 degree.
Then chest.
Chest physiotherapy.
Why we will do chest physiotherapy? What is the need? क्यों करेंगे? क्या जरूरत
To
है?
release the secretions.
Very good, Kawalji. Then what we will check?
Swallow reflex.
Now tell me one thing. Swallow reflex आप कब check करोगे?
Whenever we are giving food or whenever we are
feed.
giving medication, we need to check the swallow reflex.
Yes, very good. Whenever you are giving food, you are giving fluid, you will do what?
Swallow reflex.
Swallow reflex check.
Very. Now tell me about energy conservation methods. What are energy conservation methods? Yes.
Which
बताओ, मैंने भी
energy conservation methods are which not strain our body. patient body.
Yes, very good. And how, what you will instruct the patient how to take bath?
That if patient want to take
Sit
bath, then
on
we
the
have to tell
chair
the
and
patient
take
in
the bath.
a chair
Very
and
good. Now
and
tell me in
consume.
future, yes, in future what you can expect.
NG tube, ma'am.
It's a disease progress, and
Mhm.
in future, NG tube applied or maybe tracheal tube.
Very good. So any doubt, any queries till now you are having? Yes. कोई डाउट, कोई क्वेरी, कुछ हो किसी को?
No, ma'am.
All clear?
Ma'am,
Yes.
maybe it's look like a silly question, but how we can
No,
learn
no.
all these symptoms and these like in our mind, because we will
Yes.
confused sometimes.
Yeah, that's why I mentioned in the very first lecture, you only need to do 2-3 things. Okay, let me give you some idea. Okay, first thing you need to do is, like, if today you are getting the topic in the class, okay, like today you study, you need to revise it today, then you need to revise it after 2 days, then after 4 days, then after 1 week. If you are revising that for 4 times, it will retain in your mind, you won't forget it. Very simple method to retain anything. This is my personal method. I use this every time if I have to memorize anything. Okay, this is very simple thing. Now tell me one thing. Okay, be honest. किस किस ने फर्स्ट या सेकंड लेक्चर को दोबारा रिवाइज किया या उस नोटबुक को खोल के भी देखा है?
मेरा फर्स्ट
यस
क्लास देखा मैंने।
यस सुष्मिता, क्या कह रहे हो आप?
फर्स्ट क्लास मैंने देखा।
Okay, no, I am asking, like, if you have revised your lecture notes.
Yes, ma'am. Yes, ma'am.
If you will not revise your lecture notes, then all this process will be of no benefit. It all these efforts will go in vain. Okay, the reason being, today I am teaching you, today you will know, okay, we know everything, yes, it's clear. But after 2, 3, 4 days, if you are not revising today, then if you are opening the notebook after 5 days, you will be like, oh, what is the reason for this, how I will memorize, what she told, what ma'am told in this particular part, you will forget. So that's the because it will hardly take 10 minutes. What you need to do, you don't have to memorize today. Just open your notebook after the class or whenever you will be going to the bed. Before going to the bed, just open your notebook and give a quick reading. That's it. Just read it. Nothing else.
Ma'am,
In this way,
excuse
you will
me.
memorize. Yes.
Ma'am, if we learn it from a different type of tricks, which one NCLEX demanding? So
Mm-hmm.
in that case,
So,
maybe we will learn very easily
no.
these topics.
There is no trick to learn. Don't follow any trick. You don't have to memorize. मैंने आपको क्या बोला?
Memory trick,
आपको
it is
no,
also
listen.
affecting.
लिसन, आपको घर जाके कुछ पढ़ना नहीं है, बैठ के लर्न नहीं करना, सिर्फ एक रीडिंग करनी है. यू जस्ट हैव टू गो होम आफ्टर दिस लेक्चर, इफ यू आर इन योर होम ओनली, सोने से पहले जस्ट ओपन योर नोटबुक एंड गिव इट अ रीड. दैट्स इट. आप उसको रीड करोगे ना, जस्ट ट्राई दिस फॉर वंस. ओके, आप किसी भी चीज को जब 2, 3, 4 बार रीड कर लेते हो ना, ऑटोमेटिकली आपको समझ आ जाएगा कि वो चीज क्या है. फर्स्ट रीडिंग पे आपको समझ नहीं आएगा, सेकंड पे भी थोड़ा थोड़ा आएगा, थर्ड पे आपको बहुत अच्छे से समझ आने लगेगा, और फोर्थ रीडिंग तक यू विल बी लाइक, ओ ओके, नाउ आई नो व्हाट इज दिस.
Yes, ma'am.
कुछ समझ आया या पहले वाला भी भूल गया? यस.
मैम आज का तो आ गया।
यस भावना, बताइए व्हाट यू आर आस्किंग.
मैम मैं कह रही हूँ समझ में आया है आज मतलब डेली आता है ऑब्वियसली।
नो, आई मीन टू से जो मैंने अभी आपको ट्रिक बताई है, जो अभी मैंने आपको बताया
Yes,
ऐसे
ma'am.
पढ़ना है.
यस मैम।
follow that thing. आप एक बार follow करोगे ना, then you will feel the difference.
Yes, ma'am. I
Yeah.
will do it.
I also got to know this from one of my mentor. So he used to repeat this thing. वो मेरे सर वो बहुत बोलते थे इस चीज को क्लास में. हम उनको बहुत लाइटली लेते थे कि क्या सर ऐसे थोड़ी होता है कि we will read this thing 4-5 times. But when I first tried that thing, then eventually I got to know, no, this method is quite effective. So you should also try it.
Okay,
Okay.
ma'am.
Actually, ma'am, there is a one another reason. We also are
Yes.
very busy and hectic, doing very hectic shifts in our
Emmanuel,
hospitals.
मैंने आपसे क्या कहा है? What I asked you? I asked you only to read. I
Okay.
never asked you to give it 2 hours, 3 hours, just 5 minutes. More than
Okay.
enough. 5 minutes are more than enough. Just do this trick. You won't have to like study that much. Like you are thinking, oh, NCLEX is that difficult. No. NCLEX is very
Okay.
easy. NCLEX
We
is
will try it,
easy.
ma'am.
Yeah, you just need to follow the right path. That's it. Then you will get to know, oh, this is
आप
such a
टेस्ट
easy.
लेंगी?
हाँ, why not? क्यों
हम
आप
वीकली
टेस्ट
हो
देना
गए?
नहीं चाहते? आप टेस्ट देना नहीं चाहते या देना चाहते हो? Yes. Yes, भावना.
Obviously, ma'am. That's why we join your class.
तो मंडे आपका टेस्ट है, so be prepared.
On Monday.
Yeah, on Monday there will be one mock test of the neuro. This whole system, because tomorrow we
At
will
what
be
time, ma'am?
that I'll inform you tomorrow. It's like Saturday, I'll be informing you. You will getting one whole Sunday. You can revise. Then on Monday, you can
Ma'am,
attempt
only
the test.
these topics now which we studied.
These topics are covering the whole nervous system. Don't worry. Like tomorrow, your nervous system will be completed.
Okay.
Okay.
No, ma'am. My question is like the mock test is.
Yes, only these topics only. From this only you will get. It's not a mock, it's kind of a weekly test, we can say. Okay.
Okay, ma'am.
Okay, I will give you 10 minutes break. Then we are gonna start this new topic. It's 24. We will get back to 34.
Can you do one thing?
Yes.
Can you please just open the first slide? How to take a picture, make my notes.
Okay, Farhad, let me check. Maybe I don't have that with me. Wait.
Ma'am, please unmute yourself.
Ma'am, your screen is mute.
Yeah. So in Huntington disease, it is a genetic brain disorder, first thing. Second thing is it is neurodegenerative in nature. Then third thing is personality and mood changes. The person will forget things with time. Unsteady gait. The person will not walk properly. There will be disbalance. Then there will be
Dysphagia.
dysphagia. The meaning of dysphagia is?
Difficulty in swallowing.
Yes. Then there will be slurred speech, memory loss, poor judgment, weight loss, cognitive dysfunction, and here you will get to see psychiatric symptoms. One psychiatric symptom which is hallucinations. Now, what is the meaning of neurodegenerative? Neurodegenerative means death of brain cells. Because of the death of brain cells, there will be degradation of the nervous system. And in this disease, there is 50% chance that the disease will pass to offspring. 50% chance. that this disease will pass to the offspring of the patient. Do you know the meaning of offspring? Offspring का मतलब पता है सबको?
No, ma'am.
ऑफस्प्रिंग का मतलब होता है चाइल्ड, जो उस पेशेंट का बच्चा होगा उनमें चांसेस हैं कि ये डिजीज उसको हो पास. नाउ ट्रीटमेंट.
Sort of hereditary, ma'am.
या इट इज अ हेरिडिटरी. दैट्स व्हाई हमने यहाँ पर क्या पढ़ा है? वेरी फर्स्ट चीज हमने क्या पढ़ी थी इधर? व्हाट इट इज?
Genetic.
जेनेटिक. ओके.
Yes, ma'am.
So next is treatment. Now there is no cure. As such, this disease can't be cured. But here are few things which we can do. As you know, the gait of the patient is not steady. Then we can have fall precautions. We can follow fall precautions. Then we can give the person skeletal muscle relaxant. Skeletal muscle relaxant. Then antipsychotics. Why we will give antipsychotics?
Because there is
patient has
secondary
hallucination.
Why? Because
Patient have hallucination.
very good. And we will give antidepressants. One more thing which was left in the sign and symptom parts was, where is this? Yes. Okay, I will write in the last. Okay, you can write in the sign and symptoms part. This is a characteristic. If ever you will get this term, you will get to know it is a Huntington disease. This means involuntary, jerky, and unpredictable movements.
We should write on sign and symptoms, ma'am.
Yes, write this in sign and symptoms and highlight this point. You can write at the last also by adding stars because it is important. So this is the characteristic of Huntington disease. Mostly the people, we can say the flare up of this disease is in 25 to 45 years. The flare up of the disease. Any doubt in Huntington disease?
मैम ये लास्ट वाला साइन जरा बता दे.
इस साइन में क्या होता है? ये एक साइन है कोरिया. ये होता है हंटिंगटन डिजीज में. इसमें जो बॉडी के किसी भी पार्ट में इनवॉलेंट्री जर्की मूवमेंट्स हो सकती है और वो अनप्रिडिक्टेबल होती है. मतलब कभी भी हो सकती है. हमें नहीं पता होगा उस पेशेंट में कब होगी. कभी भी. फॉर एग्जाम्पल इफ ही इज सिटिंग लाइक दैट, ऐसे भी उसका हाथ जर्की मूवमेंट्स हो सकती है और दैट कुड बी एनी टाइम. There is no prediction of these movements. It is unpredictable. Okay.
Okay.
So first thing, Huntington disease is a
Genetic brain disorder.
and neurodegenerative. Personality and mood changes.
Forgetfulness, unsteady gait,
Unsteady gait.
And
Dysphagia. Slurred
Slurring
speech.
up speech,
Memory loss.
memory loss,
Poor judgment.
poor judgment,
Weight loss.
weight loss,
Cognitive dysfunction.
Psychiatric
Psychiatric
hallucinations.
hallucinations.
And the most important is chorea, which is involuntary and jerky and unpredictable movements.
very good. And what is the meaning of neurodegenerative?
Death of
Death
brain
of brain cells.
And there are 50% chance of passing to offspring.
Offspring.
of
Children.
Then there is no
No cure.
no cure.
what you can take.
Fall precautions.
Fall precaution,
Then
skeletal muscle relaxant,
Skeletal muscles,
antipsychotic,
relaxant, antipsychotic, and antidepressant.
antidepressants.
very good. This was all about Huntington's disease. Now we will move on to other disease. Now tell me one thing. मैंने आप सबको ये पढ़ाया था. अब किस किस को इसका कुछ याद है या आइडिया है?
Neurotransmitter.
हमने पढ़े थे ये.
Yes.
ओके. अब मुझे बताओ एसिटाइल कोलिन क्या करता था? Leave acetyl.
Parasympathetic responses.
Yes, Farhad.
Parasympathetic responses.
Very good. Very good, Farhad. एक ही बच्चे ने रिवाइज किया. दैट मीन्स अब फरहाद ने आंसर बताया. अब हमें फरहाद को वो फर्स्ट टॉपिक वी नीड टू रिवाइज हिम. ओके. सो नाउ इसमें टेल मी व्हाट इज द फंक्शन ऑफ डोपामिन.
Movement pleasure, man. It is a pleasure hormone.
Sorry.
Pleasure.
Yes.
No, I said it is a pleasure hormone.
नाउ मैंने आपको एक चीज बताई थी. आई टोल्ड यू एट दैट टाइम इफ डोपामिन डिक्रीजेस व्हिच डिजीज हैपेंस.
Parkinson.
Parkinson disease.
वेरी गुड. सो अब हमारा नेक्स्ट टॉपिक क्या हो सकता है? एनी गेसेस?
Parkinson.
आप सब तो बड़े समझदार हो.
Firstly, man,
नेक्स्ट
it is really bad.
क्या कह रहे हो आप फरहाद?
मैंने कहा कि हम लोग सारे ग्रेजुएट हैं सर. Obviously,
Yes, very good. So now in Parkinson's disease there is decrease in what?
Dopamine.
There is decrease in dopamine, and because of decrease in dopamine there is tremors. There is one more thing in Parkinson's disease. There is increase in acetylcholine as well. अब मुझे बताओ क्या एसिटाइलकोलिन मसल कॉन्ट्रैक्शंस करता था?
Yes, ma'am.
Yes, ma'am.
मसल कॉन्ट्रैक्शंस कर रहा है और ये बॉडी में भी बहुत ज्यादा हो गया है, ब्रेन में. तो ये क्या करेगा हमें? ट्रेमर्स का मीनिंग क्या होता है?
Tremors.
Seizures.
मसल कॉन्ट्रैक्शन. नो ट्रेमर्स मींस एक्सेसिव मसल कॉन्ट्रैक्शंस की वजह से ये जर्की मूवमेंट्स को ही. Then there will be
Yes.
muscle rigidity.
Ma'am, can I?
Yes.
Can you please show the first slide?
Ma'am, I think it is a very good method. Which one, ma'am, doing it?
So you are getting this way.
Yes, ma'am.
So shall we continue?
Yes, ma'am.
Okay. So now postural instability. Postural instability. There will be dementia. Postural instability, dementia, drooling, micrographia, hyaluronic
Ma'am,
crisis.
drooling is.
I will explain all these points right now. You just write it up, then I will explain. So, posture.
Ma'am, oculogyric what? Crisis.
Yeah.
Last one is, ma'am?
Cog-wheel rigidity. Cog-wheel rigidity. So now, have you written?
Yes, ma'am.
First is postural instability, which means the patient will face difficulty in maintaining balance of his body. There will be imbalance in the equilibrium. You can write, in postural instability, patient will find it difficult to maintain the balance. Patient will find it difficult to maintain the balance. Then dementia means loss of intellectual functioning. Loss of intellectual functioning. Then is drooling. Drooling means flow of saliva from the mouth. The saliva will flow outside the mouth. Then is oculogyric crisis. I will show you the picture of this as well. Now the eyes, there will be upward deviation. Both of the eyes will be in upward direction. Then I will show you the picture of stooped posture as well. Micrographia. What is the meaning of micrographia? You know what happens in micrographia is, for example, if I'm writing table like that, okay, but in Parkinson patient, he will write like this. He will write very, very small, like this. This is the meaning of micrographia. Now I will show you the picture of one. I will show you picture of cogwheel rigidity as well as oculogyric crisis. This is oculogyric crisis. This is the meaning of oculogyric crisis, the upward deviation of the eyes. The upward deviation of the eyes. Is it clear? सबको clear है oculogyric crisis क्या होते हैं? Okay.
Yes, ma'am.
Then I will show you. So here is one image which will give you very good idea of the Parkinson's patient. This disease is very important. Mark this disease important. You will get for sure questions from this disease. So here, as you can see, first, the posture is stooped, which means, as you can see, the posture in which the person is standing is not the normal one. Then masked face, which means the expressions on the face of the person. Then there is rigidity in the back. Then you can see his gait, the way he is walking is shuffling. There is tremors, shakiness in the legs. There are hand tremors. The trunk is also forward. It is tilted forward. Then his arms won't swing much. Now, जो पार्किंसन का पेशेंट होगा, जो उसकी आर्म्स होगी, it will be parallel to his body. He won't swing his arms much. Clear? Any doubt? Any doubt till now?
No, ma'am.
I will show you one more thing. Yes, Farhad?
What is cogwheel rigidity?
Yeah, I'm explaining that only. So this is cogwheel rigidity in this pattern. The rigidity. This rigidity is known as cogwheel rigidity. There is spasticity. Now reason being, now I will tell you the reason. The reason is because the tone of the muscle has been increased. So that's why there is rigidity. And this type of rigidity is known as cogwheel rigidity.
Ma'am, cogwheel rigidity is in all over the body or only in hands? Ma'am, please unmute.
It is only in hand.
Okay.
Okay, then there is masked face expression. What is masked face expression? I have mentioned, I have shown you the picture as well. Yes.
The patient doesn't move his eyes or facial expression.
Good. Then there will be pin rolling tremors. He will have have his hand movements like this.
Okay.
Then bradykinesia. This means the movement of the patient will be very slow. He will walk very slow, very, very slow. This means no expressions. This is also known as facial hypomania. You can write this as well if you want to. This is known as facial hypomania.
Facial.
Yeah, facial. Because facial expressions are absent. Right?
Yes.
Now you can note one more thing. This is known as the triad. Triad. Pin rolling tremors, bradykinesia. What is the meaning of bradykinesia?
Walk very slow.
Slow, rigidity and no expressions. Few more things like I have shown you in the picture. There will be reduced swinging of arms. reduced swinging of arms during walking. Then baby steps. What is the meaning of baby steps movement? What happens in baby
Because he
steps?
will walk like a baby.
Yeah,
Because
he will
very
be-
slowly.
Small
he will,
steps.
no, not very small. His steps will be very small. He will walk like this.
Yeah.
Very small steps. Then decreased blinking. Then hypophonia. Hypophonia means decreased voice. Okay, done with the sign and symptoms. Any doubt till now? Yes. कोई डाउट हो साइन एंड सिम्टम्स में किसी को?
No, ma'am.
Clear?
Yes.
Then we will move towards management. Levodopa and carbidopa. Now put star. अब मैं जो आपको लिखवाऊंगी उसके ऊपर आपने स्टार डालना है because it is very important. NCLEX point of view, it is very important. Now, जो ये दो ड्रग हैं, these two drugs you will never give with you will not give it if there is melanoma condition in patient and glaucoma. Just write this. सिर्फ आपको ये चीजें लिख लो आप. लीवोडोपा और कार्बिडोपा को आपको इन तीन चीजों के साथ कभी भी नहीं देना. One more thing you need to keep in mind, if you are giving this medicine, you need to avoid vitamin B6, which is कौन सा vitamin B6 किसी को पता है? You all are graduated, yes.
Right.
Pyridoxine.
European Syncopine.
You need to avoid vitamin B6 in patients who are having levodopa and carbidopa. Any doubt, any queries till now? Because this part is very important. This part is very important. You can mark it with other color or whatsoever you like to. Then this medication, this particular medication takes 3 weeks to act. This medication takes 3 weeks to act. Now, talk. One more thing, important thing. First, you should mark this one. This is very important. If there is psychosis in patient and the patient is taking this medicine, you need to report. You need to report psychosis in the patient. You need to report psychosis in the patient, which means if there is any delusion, hallucination, those symptoms, if you can see, then you need to report immediately. You need to report immediately to the doctor. Then, this is also hallucinations. These are the symptoms of psychosis, okay? So this is also medicine, ropinirole. Now what it does is, it stimulates It stimulates dopamine receptor. It stimulates dopamine receptor. Then we will give anticholinergic. Why we will give anticholinergic? Yes. Because there was excessive salivation in the body. To decrease the secretions, we will give anticholinergic.
Ruling.
Yes. But there are some side effects also. Side effect means there will be dry mouth and constipation. One thing you need to keep in mind is you will not give in angle closure glaucoma. Let me write here. Yes, done.
Noting angle closure glaucoma.
It is a type of glaucoma. There are types of glaucoma, so one of the type is angle closure glaucoma. Done. Shall we move forward?
Yes, ma'am.
So now, क्या इसमें ट्रेमर्स थे? ट्रेमर्स थे पेशेंट में? पार्किंसन के पेशेंट में ट्रेमर्स हैं?
Yes, ma'am.
ट्रेमर्स
Pain rolling tremors.
वेरी गुड. इसके लिए हम ये मेडिसिन देंगे. दिस इज फॉर ट्रेमर्स ओनली. दिस इज फॉर ट्रेमर्स ओनली.
Diphenhydramine.
Diphenhydramine. Diphenhydramine. Please mute yourself. Diphenhydramine. Now we will talk about nursing interventions. First, you need to monitor aspiration. Then, fall precautions. Then, lightweight shoes. No rubber sole. The shoes, if it is Velcro, then it is good. You know what are Velcro shoes? किसी को पता है Velcro shoes क्या होते हैं? वो ऐसे stick on वाले जो होते हैं. Let me show Velcro. The reason of giving Velcro shoes is because patient is having tremors. तो उसको laces में problems होगी. Let me show you image of Velcro. बचपन में तो हम सबने पहने हुए ये shoes. We all have used these shoes, Velcro shoes. These are Velcro shoes. इनको कहते हैं हम Velcro shoes. ये पहने हुए सबने या नहीं?
Yes, ma'am.
सबने पहने स्कूल में, right?
Yes.
So these are Velcro shoes.
And ma'am, in nursing intervention, what is our first priority for Parkinson patient?
Okay, now tell me what should be your first priority. A, B, C. Yes, very good.
Aspiration.
Right.
A and B.
Good, good. Speech and language pathologist. Then you will increase fluid and fiber in the patient. You will instruct the patient to take big steps. If the patient freeze means if he stops walking, then instruct the patient to do deep breathing and then restart walking.
Ma'am, if freeze
means अगर वो चल रहा है, he is walking. While walking, in between he stops walking. He is standing there. Then you will instruct the patient, if such thing happens with you while walking, you stop and so you stand there. You can take a deep breath and then you can again start walking. Okay.
okay.
What was after big steps?
Big steps means you will ask the patient to take big steps. As we have studied here, the patient will be taking small baby steps. So you can help the patient to take big steps. You can
Ma'am, I
provide
know.
him.
I'm saying that. I'm saying what was after that.
What was after that?
I could not write it.
Yeah, next start.
Okay, ma'am, done.
Then you will also instruct for facial muscle strengthening exercises. So that was all about Parkinson's disease. Done? Okay. Now tell me, which neurotransmitter is affected in Parkinson's disease?
Acetylcholine
Yes.
and dopamine.
Acetylcholine and
Which one decreases and which one increases?
dopamine decrease.
Dopamine.
Acetylcholine was increased.
And if acetylcholine is increasing, what it will lead to?
Tremors.
Muscle contraction.
Muscle
tremors.
contraction.
Okay, good. And then what are the signs and symptoms?
Muscle
Tremors,
Postural
muscle
instability.
rigidity, postural instability,
Amnesia, drooling,
drooling,
micrographic,
micrographic,
oculocytic
soft
crisis,
posture, cogwheel rigidity, masked
coagulating,
face expression,
musculoskeletal,
pin rolling tremors, bradykinesia.
body,
These three are the triad.
no express
What is
emotion,
the meaning of bradykinesia?
Walk very slow.
Slow. Yes. And what all?
Reduce swinging
What-
of arms during walking. And movement is
body, baby steps
hyperphonia.
movement,
What all medicine
blinking
we
gait,
will be giving?
Levodopa,
Levodopa,
carbidopa,
carbidopa,
And what you will
Phenol.
keep in mind while
Antibiotics.
giving these medications?
never give with monoamine oxidase inhibitors
MAOIs,
and
melanoma,
and
and
glaucoma.
glaucoma. And one more thing was there.
avoid
Vitamin
vitamin
B6.
B6.
Avoid vitamin
You need-
B6.
Okay. Now tell me which type of shoes you will educate the patient to
Velcro
wear?
shoes. Velcro shoes.
Velcro shoes.
To decrease secretions,
And
which medicine?
no rubber shoes.
Yes. To decrease secretions, what you will give?
And cholinergics.
Anticholinergics.
Anticholinergics.
And what are its side effects?
Dry mouth, constipation.
Constipation.
And in what condition you will not give glaucoma? In what condition you will not give anticholinergics?
When glaucoma.
Which one?
Angle
Which one?
glaucoma, ma'am.
Angle closure glaucoma.
Because
Very
it
good.
will increase intracranial pressure and stability.
What about trigeminal? What is trigeminal? What is
Also called, ma'am. Ma'am, it's a
You are
fifth cranial nerve.
You are
And
mute.
it is a
it is the fifth?
Sensory disorder.
No, I'm not talking about disorder. I am only talking what is trigeminal nerve. It is the fifth cranial.
Fifth cranial nerve.
Yes. And what is trigeminal neuralgia? So, Farhad, this was our first topic. Trigeminal neuralgia. Now tell me what it is, one by one. Okay. Only those will answer. Otherwise, you need to mute first. Rupa. Rupa, please unmute yourself.
Yes, ma'am.
So, what is trigeminal neuralgia?
It is a sensory disorder of trigeminal nerve. And
Very good. Kawaljeet?
Yes, ma'am.
Yes, and what else was there in trigeminal neuralgia?
There will be severe pain on the lips, gums, and cheeks, and severe
what
burning
else?
and pain can be one side twitching and blinking and tearing also.
Very good. And what all things you will avoid?
We need to avoid the hot and cold fluids to the patient. We need to teach the patient don't chew. If he want to chew or any food or something, unaffected side he can chew the food. And caffeine should be avoided because it will stimulate the nerve.
Thank you. Emmanuel, your turn. Please unmute yourself. Ma'am, okay, man. Who's this? Okay, yes, Emmanuel. Yes, Rosaline, you can leave. Yes, Emmanuel. Then Govindraj.
Yes, ma'am.
Yes. What else was there in trigeminal neuralgia? What you need to educate to the patient? They need
No
to educate.
massage.
No massage. Then?
No massage. Any type of massage in face.
Yes. And soft cloth to clean face.
Soft cloth in use. And
then paper and pen to
communication.
For communication purpose, because there will be severe pain in the lips, cheeks, so that the person won't be able to speak. So we can provide him pen and paper so that he can tell whatsoever he want to tell. Then the one more thing you need to note is room temperature should be normal. Room temperature should be normal. Now tell me why room temperature should be normal. What is the reason?
Because we need to
avoid the hot and cold.
Because हमने पहले ही we have discussed कि we will not provide him excessive hot and cold. Okay. So what about medicine?
Carbamazepine.
Good.
Gabapentin.
And the surgery, what surgery we can do? Not we can do, what surgery?
Neurosurgical pain
Rhizotomy.
procedure.
Yeah, rhizotomy can be done. So that was all about today's lecture. So what all we read? First was trigeminal neuralgia, then बोलते चलो टॉपिक
Bell's palsy.
Bell's palsy.
Bell's
then
palsy. Then
Then,
amyotrophic lateral
myotrophic.
sclerosis.
yes,
Then Huntington disease.
Huntington's disease, yes, good. Then
Then Parkinson's disease.
वेरी गुड. आज हमने कितने टॉपिक्स कवर किए हैं?
5.
5 टॉपिक्स. एंड पार्किंसन इज समथिंग, ये ऐसा डिजीज है which you should know each and every point of this disease. It is very, very, very important. And you should know one more thing, difference between these two diseases, because इसमें students बहुत confuse होते हैं. Okay? So any doubt, any queries till now? Yes, any doubt?
No, ma'am.
No, ma'am.
No doubt, all clear?
Till now,
Okay,
no,
so
ma'am. When we study, we will get back to you.
yes, then you will get
Study
doubts.
time will
Yeah, and then tomorrow I will be asking you
maybe.
questions. Okay, and tomorrow we will
Okay.
wind up this whole nervous system
Ma'am,
and
for Huntington
yes,
disease, we didn't discuss about the treatment. We don't need.
I think we have.
Treatment is no cure, false
There is no
precaution.
treatment. Huntington
No cure.
disease, I have like I told you to write, there is no cure, only nursing
Yes.
intervention.
Okay.
One more thing there was about Huntington disease, that it is which one? Genetic. First thing, it
Yes.
is genetic. Second thing, it will pass on to the offspring. There is 50% chance. Okay.
Yes.
There is no cure, and you need to only follow few nursing precautions. That's
Okay.
it.
Okay.
Okay. So Huntington is one disease which has no cure. Then multiple sclerosis also, it has no cure.
Okay.
You need to keep this in mind. Which disease has no cure? Which disease is progressive? What which disease was neurodegenerative? In
Huntington
which
disease,
disease? Yes. And there will be
Huntington.
personality and personality and mood changes
mood
as well.
changes. Yeah.
So these few things you need to keep in mind. Okay. So that was all about today's topic and today's lecture.